Here to chat about an experience that is unfortunately all too common for women, our family physician, Dr. Antonia Sappong, and Cityline makeup artist, Grace Lee, in the house. Thank you, both of you for coming. So I said that this is an issue that is actually common. We actually have people in the audience that have been through this. We're going to talk about gaslighting. Okay, so gaslighting, have you heard the term before, gaslighting? If you're experiencing gaslighting at work or in your relationships, it may look like having your concerns be dismissed or discredited. But what happens when gaslighting takes place in the doctor's office? Grace, this happened to you, but first I'm going to go to Dr. Tony. How would you describe gaslighting as it relates to women's health?
Yeah, I think it's the experience of having your symptoms dismissed by your healthcare provider, or I think what's actually more common is having them attributed to other factors. So things like stress or anxiety or hormones, or it's a natural part of being a woman, those sorts of things, without any real history or physical or investigations to fully investigate what the actual concerns are. And it, of course, can lead to problems where things are missed, important things, and they can have health consequences.
Well, speaking of important things, Grace, you have been through this. You experienced this when you had complications during perimenopause. Can you tell us your story?
So last year, let's just start with, I had my period for 6 weeks. So it was straight. It was, and it wasn't just like a light spotting kind of period. It was 6 weeks of torture.
Heavy flow.
Yes.
Yeah.
And so rewind, I think at week 2, I did realize that this is not normal, and I went to see my family doctor. My family doctor then ordered an ultrasound, which again was going to take about another 2 weeks. There was COVID restrictions. You know, even seeing a family doctor was hard. And then then I think at like week 4.5, I called my doctor and I said, it's still going. And she said, go to Emerge right now. So I waited for 13 hours to see an emergency doctor, and he did 1 blood test. He didn't even test my hormones, but what he told me when the blood test came back was that it was due to my hormones. And he was very dismissive, and it was, I just was stunned. I could not believe that I did not get an ultrasound. I did not even get an internal exam. It was just very, very frustrating.
How did this whole story end then? So you're bleeding. Like, what do you do about this situation? How did it end?
Well, so how it ended was he gave me a prescription for charismatic acid, which is supposed to stop bleeding for 50% of patients. And I was not in the 50% that it worked. And then days later, I was feeling very, very ill. And luckily, I had a friend whose husband is also a doctor and told me to go to another hospital that had an emergency OB on site. So when I went there, my hemoglobin was at 72. You get a blood transfusion at 70. I was literally gray. I couldn't even drive. My husband had to drive me. And I had an internal exam. I had 2 ultrasounds done. I had an iron infusion that took 3 hours because my iron was super low. And I just could not believe that the care and the assessment was so vastly different from a hospital that was like 12 kilometers away.
Yeah.
It just seemed so unreal to me.
It seems unreal, and it's so much more often than we actually discuss. This happens a lot to women, Dr. Tony. What are your thoughts on this whole situation?
Yeah, medical gaslighting is a huge problem. I think this story in particular points to a few different issues, one of which is if you think about society and the fact that medicine is part of society, we have a tendency to discredit or to deem less credible women, particularly women of color, poor women, women with disabilities. And so the same biases and stereotypes and stigmas that we have in society, we find them in medicine. And they're often amplified because it's a high stakes, high stress environment. And so I think that's part of what has happened. Unfortunately, I think it also points to the fact that our emergency departments are unfortunately under tremendous strain. They were during COVID. You know, the under-resourcing and lack of support, it doesn't lead us to do our best, unfortunately. And this certainly was not the best of our healthcare system, right?
Yeah.
And then I think the last thing that I really want to point out is that there's an uncertainty around women's health. And that is because of historical mistreatment of women. Essentially, up until the 80s and 90s, we were not including women systematically in our controlled trials, meaning that the research body that we have has largely excluded women for years.
So it's just
decades.
men being studied.
Men they're assumed to be the default.
Yeah.
Women often were felt to be more complicated because guess what? We have hormones.
Right.
And they
That is
fluctuate.
wild to me.
It is wild. And as it turns out, we're not just men in disguise. Who knew?
We're not.
Who knew? So it's all just very frustrating. And so there's a lack of knowledge where we do now have knowledge because more studies are being done. It's still it's not made it into medical curriculum. It's not made it into the general body of knowledge, I wouldn't say. So there's just more uncertainty. And I think when doctors have uncertainty, they try and find that certainty. And sometimes rather than being able to say we've done all these investigations, we've done all these tests, we're not really sure what's causing your symptoms. Rather than saying that, they'll say something like, well, we've done all these tests, everything was normal. And I think it's actually just an insert stress or hormones or anxiety.
It's all in your head.
It's all in your, they probably won't say that, but essentially that's sort of what it feels like, and it really shuts down the conversation and it leads to things being missed, like in Grace's case.
So we're sort of discredited because I guess they think we don't really know what we know, and then they don't necessarily have the information because we haven't been studied in a lot of clinical trials. So we've got a double whammy going on.
Yeah.
And Grace, I'm just wondering, did you feel able to advocate for yourself? What happened?
No, because he told me my wife had this, it's hormones.
Oh,
and he was basically just very dismissive.
Yeah.
Also, he is in a level of authority.
Yeah.
And he then said, well, this is a life and death emergency department, so even if I ordered you an ultrasound like you're asking, if we discovered a cyst, it wouldn't be life or death. You're not dying. So that was it.
Couple of things. I see the confluence of us sort of being raised by a generation of folks that are very much about respecting the authority, and we were raised under that as Gen X kids.
Yes.
My parents are like, but the doctor said this, but the teacher said this, and you believe the teacher, and you believe the doctor. And then there's generations coming up that are like, we believe nobody and we don't care. We're in between that, right? So it's difficult to find the wherewithal to stand up for yourself. But Dr. Tony, you've got some tips for us to sort of make this situation hopefully go a little bit smoother in the future. What can we do to properly advocate when we're in this situation?
I think what Grace did was actually fantastic. If you have an emergent situation and it was not dealt with appropriately, going to another emergency department or going back later is important because we don't want to miss an emergency.
Right.
Out of those emergent contexts, I think what can be helpful is taking a support person with you. There's someone who's often a little bit less stressed in the moment. They can hear things a little bit better, perhaps. They can ask more questions. They can just be your advocate in that scenario.
And strengthen numbers.
Exactly.
You probably feel a little bit more comfortable, like you're with somebody.
Exactly. And then often if you're having symptoms over a period of time, I'd say write them down. And then also write down all of your questions so that when you go into the doctor's office, you're armed with as much information and you can have really full conversations and make sure nothing gets missed. Because often if there's, if it's a high stress situation, it can be hard to remember all of the things you wanted to discuss.
Yeah.
And then other things to know, you can always request copies of your records or your results. You can also always request a second opinion, so getting a specialist consult.
Yeah.
And then also just, knowing that you have the opportunity, if you really feel that something was missed, you can always ask in that moment, hey, look, I understand that you would not like to order this test, but I'd like you to document in my chart that you are refusing this investigation and the reasons why. It may not change anything about what's done, but it causes a moment of pause that might be valuable in that moment.
I love this advice. Thank you so much, both of you, for sharing. I'm happy you're on the other side of it. Grace, oh my goodness. There's so much more coming up. Stay with us, everyone. Oh my goodness.